This is our, I think that is our third webinar for New Zealanders. We do this every month for our regular webinar, informational webinar, but this is specifically tailored around you guys in New Zealand. We try to cover most of the questions that people have, but if we don't cover it, you're welcome to ask at the end. Just a little bit about me. I've been involved in medical tourism from 2007, specifically in Mexico. I've traveled to a lot of locations in Mexico and familiar with doctors, facilities. And at this moment, our focus is in Tijuana, because Tijuana has established itself as a center for bariatrics worldwide. And we do surgery in Guadalajara as well, but main operation is in Tijuana. I started Mexico Bariatric Center in 2012, and it's been one of the leading companies that provide this to global patients. I'm going to, Vanessa is our underground New Zealand patient coordinator. We started working with her a few months back, and I'm gonna let her talk about a little bit about her journey with us. She's our past patient as well, and kind of go over that. Of course, we will have her talk more at during the presentation, but right now, Vanessa, go ahead and tell us about your experience, about yourself, and we listen.
Okay, thank you. Kia ora, everyone. I do recognize some of these names of people who are listening, so welcome. So I'm Vanessa, as Ron said, the newest New Zealand patient coordinator. I had my surgery back in November 2023, and my surgeon was Dr. Gutierrez. And I looked a little bit different then. As you can see from one of those photos there, my heaviest was 115 kilos, and now I'm down to 58 kilos. So I lost a lot of weight, and in the first 6 months, actually, a lot of it came off in the first 6 months, and now I'm at a weight where I don't think I've been this light since I was 18. And it's just such an amazing feeling to have this confidence back in yourself, and that's what I feel Mexico Bariatric Center has given me, because like many of you, I have tried or did try lots of other diets, and always weight went back on, and usually more weight went back on. And you'll see the reason for this a little bit later in the slides. Ron will explain why this happens. So the whole process for me was really easy. There wasn't anybody from New Zealand at that point. I was liaising with somebody in the United States, and but even so, it was still an easy process. And I did do a lot of research on Mexico Bariatric Center, because, you know, there is that worry there that you are booking with a foreign company and you are traveling to a foreign country that usually we've heard only negative things about. So like most of you, I did all of the research and I only found positive things. And so that's what led me to book with them. And the whole process was straightforward. And and just so easy, you know, getting picked up from the airport in San Diego and having that help traveling across the border. You think things are going to go wrong, and they didn't. We got to the hotel and filled lots of forms in, and everybody that I met spoke English. Dr. Gutierrez, his English is excellent, and I met him before having the operation, and I got the opportunity to ask him questions, go through a few things with him as well. And yeah, the whole thing was just really good. And the recovery afterwards, it took me maybe a month or so to sort of feel normal, if you like. I did have a Roux-en-Y bypass, so a little bit bigger than your sleeve surgery, but even so, it was you know, like I say, it was really good. It has 100% changed my life for the better. And like everybody else that I've heard now say, I wish I'd done it years ago. 100% wish I'd done it years ago. And why didn't I? Because I just didn't really know about it, to be honest. Compared to New Zealand, $30,000 it was going to cost me in New Zealand, and I didn't have that much money. And the cost viewpoint, you know, of 6 to 10,000 US dollars is really, really good. Sorry,
Yeah,
4,000.
we would go over the packages soon. So
Yeah, yeah. So
very good.
lastly,
Yeah.
should I just say a little bit about what I offer, or do you want me to talk about the group travel?
Yeah, we would go over the packages
Okay.
short. Yeah, thank you so much for sharing. It's great to have you as a patient and great to have you as a coordinator. So some updates about our new hospital, Hospital Razar. We are basically offering minimally invasive procedures like weight loss surgery, plastics, post-bariatric patient plastics, cosmetics, and we also offering women's wellness like hysterectomy and endometriosis and procedures like that. So, and we constantly offering new procedures if it's available. Like we started offering SASE, which is a great new procedure. Dr. Gutierrez is going to explain that. It's less invasive than duodenal switch, but more effective than a bypass. I mean, we are one of the top providers of bariatric surgery worldwide, and we have everyone's eyes on our hospital, everyone's eyes on our doctors. We had two of the influential doctors just visit us not long ago. It was great to have them in our hospital and mingle with them. We have this other announcement we'll be soon coming to New Zealand with 3 locations. November 21st. Vanessa probably has more words to say about that, but basically we will be in Palmerston North, Christchurch, and Auckland. And we start with Auckland, of course, in 21st. And Dr. Gutierrez is going to be with us, and the 3 of us you would see in person. So yeah, Vanessa, do you want to say something about our upcoming seminar? Sorry.
Yes, I can do. We haven't quite finalised the Auckland venue yet, but for Palmerston North we have. That will be Saturday lunchtime, early afternoon at the Copthorne, and in Christchurch we're there on the Sunday, November the 23rd, and that's also an afternoon, whereas the Auckland one on November the 21st will be around 5 o'clock, I believe. Yeah, and as soon as that venue is confirmed, I will let everybody know.
So yeah, I've never personally been New Zealand. It was one of the spots that I was on my bucket list. So we get to see New Zealand and also see you guys in person. Our website has been one of the top resource for bariatric surgery and medical tourists who look to get surgery done in Mexico. And we constantly publish new articles, new information about whether it's for diet, pre-op, post-op diet, or new procedures, like I mentioned, like SASI, or anything that we offer new, or any research, scientific research procedure. We are always posting, so it's good to check often to see what is the latest and greatest. As far as the topics that we cover today, we're pretty much covering what obesity is, which we all know. What are the risks? We pretty much know, but we would reiterate over those. And we would talk about weight loss surgery. What is so magic about weight loss surgery? Then we would get Vanessa to explain to us for the, we have our normal packages are all inclusive, but that means that you'll be traveling by yourself. But we also have groups that we started coming from September that Vanessa is going to explain. What is that entail? And the times that we have already allocated for that. And Dr. Gutierrez is going to take over at that point and talk about all the procedures we offer, whether it's laparoscopic, endoscopic. And at that time, when he's done, we will talk about the importance of bariatric vitamins. Of course, this is something we offer in the US, and I can imagine probably you cannot, the cost of shipping has been prohibitive, so it will be very difficult to get you guys. We are trying actually to have it available in the hospital, so maybe you can take some with you, but regardless of where you get that, whether you get it from Emerge, which is our brand, or anywhere else, make sure you take the bariatric specific vitamins for the procedures that you receive. And at that time, we open up for questions, and we would try to answer all questions. And at the end, we do the $2,000 raffle for people who join a little later. Please make sure you have a health questionnaire in our system, and watch this webinar to the end. And we would release the Zoom pool at one point. Make sure you complete that too. Well, basically, obesity is a disease that is becoming in a pandemic proportion in our time, and it's a global problem. And, it's coming from so many factors that we would see that, our lifestyle, lack of physical activity or nutrition, we are used to big meals, the sugary drinks, ultra processed foods, stress also. These are all factors that contribute, and other factors like inadequate sleep, and also genetics has a big part of it. But these are all contributing to this problem that we are facing worldwide. The definition in the medical field, very simple. They put your weight and height in a formula. It gives you a number, and they call them body mass index, BMI, and it puts you in a category. As you see, if you're below 25, you're normal. Anywhere you start going from 25 above, then you're in the overweight, and at 30 and over is called obese. One thing about our center that you're going to see later on is not just the variety of the procedures that we offer, also each procedure that we offer, we can handle to the extremes. Like for example, for BMI, let's say if you like to get a BMI sleeve and your BMI is, we can handle BMI of up to 110 in our center. So this is the expertise that we offer in our center. There is no limitation on what we can handle. Quickly, I want to cover about, you hear like, oh, gastric sleeve, you lose 60 to 75% of your extra body weight. And again, the BMI is a generic formula. I mean, it doesn't take into account our body size, the frame size, or basically age, or being a female or male. So let's say this, if you were to look at this more closely, you see that, let's say if a female is, well, these are all inch, I'm sorry. You should have, they converted the pounds to kilogram, but they didn't convert the height. We're in US. So let's say if I am, I think, what is it? 5'4" is 162 centimeter. Yeah. So at 5'4", a mid-size frame female ideally should weigh about 54 kilogram. And let's say if you weigh 100 kilogram, you have 46 kilogram of extra weight. Based on the published literature, the sleeve is supposed to, let's say, average weight loss of 70%. So you're going to lose 32 kilograms. So you're going to end up with 68. So if you were 54, you should end up with 68. But then again, I want to emphasize, this is a tool that you acquire, whether you get a gastric sleeve or a bypass or duodenal switch. These are just numbers. You should be able to get to your ideal weight or your goal weight. Everybody is comfortable around a certain weight. So this is how you come up. Also, I was looking around on the weekend, and I looked at the ideal weight based on age. So when we are like younger, we can afford to be a little heavier, and we are heavier, right? We lose muscles, we lose mass. So based on age, as you see, when we are looking to calculate our ideal weight, we have to also consider age as a factor. Anyway, when we gain weight, our fat cells or adipose tissues not only get larger and increase in numbers, they change, structural change is happening. So on the right side of my screen, you see a structure of the adipose tissue of a lean person. And on the right side, you see, on the lower part, you see adipose tissue of, I'm sorry, the other way around. So the bottom one is lean, the top one is obese. So when we gain weight, that structural change causes all sort of health issues, including diabetes type 2. We're not going to be sensitive to leptin, so we don't feel full. And we're not going to respond to therapies. Actually, you know how we get older, our muscles don't respond to protein and exercise? That's happening when we gain weight. So even if we're taking protein and we are exercising, our muscles not going to respond to that. So there's a bunch of problems. Is a major risk factor. In New Zealand, 34% of adults are dealing with this issue. And sorry, I think actually I would play this because this sometimes I play. Let's see if you can get that.
It's one of the major muscles that helps with breathing. Breathe in and the diaphragm contracts and the lungs expand to take in oxygen. But if you're obese, fat in the abdomen can push on the diaphragm, limiting how much air you take in.
So as you see, it's affecting all of our organs. It is affecting all of our body, all over from our top to bottom, and it really affects, you know, cardiovascular problems, inflammation, and during COVID, we realized that, hey, we need to start having a healthy lifestyle and lose weight, because the more fat cells we have, the more chance of we end up in a hospital, we end up in ICU, we can die from it. So what are the solution to cure obesity, right? Of course, diet and exercise is the first thing that comes to our mind. Diet is great. Eating healthy and clean is great. Exercise is great. Being active, regardless of whether you get the weight loss surgery or you're not, you need to be active in your life. But for obesity, that is not a definitive solution. So it's not a long-term solution for obesity. Then it becomes pharmaceutical. Since the beginning of human history, we've always looked for a magic pill to take and lose weight. It's just not us, before us, all the time. So now they came up with this magic injection, which is soon probably the pill would follow. So magic injection, we'll see the comparison. Actually, okay, I covered that in a bit about Ozempic, Wegovy, Manjaro, all those. Again, those are not long-term proven solution. Again, it's not a long-term solution. And bariatric surgery is a gold standard because it's quick, it's safe, and we're going to see why it's quick, it's safe, and it's long-term. You know, when we go on diet, our body is going to react. It increases our hunger, decreases our metabolism, decreases our satiety, and is like trying to get us back to where we were. So we talk about this. Weight loss surgery, basically bariatric surgery, basically it resets our metabolic system. That's the key word. Metabolic system is reset. So if I weigh 250, my brain, my hormones are interacting or functioning around that weight, and it's like my body thermostat is set at 250 pounds, or let's say 150 kilogram, or whatever weight we are. And yes, if I go on extreme diet and I do boot camp type of exercise, I can probably manage to lose 75 pounds if I'm young. But maintaining that is hard because your brain wants to take you back to the weight you were. So what does it do? It increases your hunger, and it lowers your metabolism. And that is the resistance we saw in the previous slide, right? It's trying to get you back to where we were. So it's a constant battle. Now, here's the magic. When you get up from the surgery, we've seen that. We see these patients coming, and the minute they've done the surgery, they like get energy. They start losing weight immediately because the surgery is resetting your metabolic system by changing your hormones. Of course, mechanically it gives you restriction too, but that's the difference. Right away, when you wake up, your body's thermostat or your metabolic system is reset at 175 pounds. What's going to happen is your hunger goes down and your metabolism goes up. It's a magic, right? But talking about different treatment options for obesity, we like this pyramid. We're saying, okay, for most people, the diet and exercise is not a long-term solution or is not a solution at all. And then it comes the Ozempic type of injections. Those also is a great medication, but we'll see what the drawbacks are. And it comes after that, the endoscopic procedures. Some people can still use gastric balloon and endo sleeve, which is we call ESG, to lose weight and maintain it, but that's again for a smaller portion of population. And then it becomes bariatric surgery, which is the gold standard, like I mentioned. So if you can't afford to have the surgery where you are, or the wait times are long, what's the solution? You go across the border to some other countries that can offer this. And it used to be a time that Mexico was only a cheaper option, but now it has set itself to a place not only the surgeries are affordable, the type of expertise that are in Mexico is above a lot of countries. So you just don't get an affordable surgery. You're getting you're getting these experts to work on you. And we'll see, like Dr. Gutierrez, you see why we're talking about that. The number of procedures he's done, the type of procedures they can offer is complete, is out of this universe. So also, you want to go with a company like Mexico Bariatric Center because we offer complete packages. We do all the logistics. We know the facilities, we know how they work. We have the drivers work with us. We have drivers that have worked with us 11 years, for example. So we know the in and out of how to get you there safe and have a great experience. This is about trusting the company, like Vanessa mentioned. You worry about, oh, I'm going to Mexico. You are trusting the company that is Mexico Bariatric Center to go and get this procedure done. Okay, so I mentioned about costs, right? Of course, it's much lower than New Zealand, at where you guys are. Again, we are right next to US. You actually fly into US. Whether you go to San Diego, in the case of the group LAX, our surgeons are highly experienced and skilled. Dr. Gutierrez, for example, I don't know, he's probably done easily over 6,000 surgeries, and he's just still very young. And this is the type of expertise you're getting. I always, like, it's funny, in Europe, like Turkey has established itself as a place for hair transplant. And so the same thing, Tijuana has established itself as this center for bariatrics. So this is where you go to get not only inexpensive procedure, you get the best of the best. Of course, you know, the company you select is very important. Our packages are all inclusive. Of course, you know, the Mexicans are very warm. They're very genuine. So that's a difference. And the weather in Tijuana is pretty much great year round. And that's another plus. So you don't have to be restricted. Oh, I can't go because it's too cold or too hot. A little bit about Mexico Bariatric Center. Like I mentioned, I started Mexico Bariatric Center, MBC, 2012. We are a US-based corporation. And since the inception, our mission has been providing highest quality of medical care with the most affordable prices. We have 13 years in business. We have performed 28,000 procedures among all of our surgeons, of course. And we use the 5 top quality surgical teams in Mexico. And since we started talking about the numbers, all the companies are publishing numbers which we know they're not correct. So these 28,000 is as of June 1st of this year, and you know they're real people. They're just not numbers. Why choose MBC? Again, the type of board certified surgeons we work with, the number of years we've been doing this. Look at our reviews, look at our videos online, our patients' testimonials. You get VIP treatment, and we are successful because we do so many things right. One of the things we do right is we manage our surgeons' load on a daily basis. Based on the complexity of the procedures that they offer, we cap them at a capacity so they're not going to get exhausted. You know, I know some surgeons can do more surgeries a day, but we are all human beings. When you do the 6th one and the 7th one and the 8th one, we see that often. Or another thing I have to mention is some of the times these surgeons are just a name. You know, they really don't do their own surgery. So they're very famous. They're the face of the company, but they use other surgeons to do the surgery. They just around, they maybe go in and out of the OR. But this, like Dr. Gutierrez does every surgery himself. So this is what you're getting. And that's why our complication rates are less than 1%, which is published at 2.8% in the US. Just a little bit about the packages and the potential savings here, like what is in New Zealand and what you get from us. But again, I'm going to let Vanessa talk in a little later about our packages. Another, you know, when you see these advertisements on TikTok and Instagram, please do your research, because some of these surgeons are just starting. They've been working as an assistant surgeon, and I always compare an assistant surgeon to experienced surgeon like a pilot. You're getting a pilot who has only 200 hours of flight time versus a pilot who's been around for 10 years and has 10,000 hours of flight time. You are giving your life to these people. And most of the time, nothing happens. But when the turbulence happens, you want to have experienced surgeon work on you. Again, I talked about social media. Make sure the ads that are attractive and they're funny or they're whatever, just make sure there is a company behind them. Who is running the company? What is behind the website?
Say we're too young, they don't know what to think about it.
Okay, so now about our hospital. This is a project that I started in 2021, end of 2021, and we just finished in September of last year. The name of the hospital is after my mom. It's a tribute to my mom, Hospital Azar. We saw the opportunity to take the medical care and the patient experience to the next level by opening this hospital. It has 4 operating rooms, state of the art, everything from the sterilization to the equipment, everything is the best that industry has to offer right now internationally. And we have 40 beds. The views are extraordinary. I was just down there yesterday. I was talking to a plastic patient that came with his cousin, and he was saying, I was asking my cousin always to make sure the curtains are up to enjoy the scenery. And these are not just pictures. You're going to go there and see the level of the hospital. This is one of the best that I would say in Mexico and maybe internationally. And remember, this is not a walk-in hospital for emergency, for heart surgery. We are doing only certain type of surgeries here, so it's especially designed and is operating around that type of procedure, that type of patient. So our nurses, our staff, everybody is specialized in that type of procedures. So that's why one of the reasons our complications are so low is one of them is the hospital specialized in one area. Okay, so these are our all-inclusive packages that we offer without the group, So basically it covers the hotel night. You can stay in hotel or the hospital the night of before the surgery, and then the hospital night, whether you stay 2 nights, 3 nights, all the other fees, including, the surgeon fees. Now, remember, if you come by yourself, you can stay in San Diego or in Tijuana more days. All you have to do is ask your coordinator, which is going to be Vanessa, and she's going to explain and make sure the reservation is made for you. But now we started having the groups that coming from different times of the year. Vanessa is going to explain to you what this itinerary look like, what it covers. So Vanessa, take over, please.
Okay. So day 1, when we leave New Zealand, is on the 22nd. We're flying from Auckland, so all you would need to do is get yourself to Auckland Airport and meet us there. We actually travel back in time. We arrive in LA before we left New Zealand, according to the date and time, which is pretty strange, but there you go. And once we arrive in LA, we will be picked up by one of the drivers and drive down to Tijuana, which does take a few hours. We will go straight to the hospital at that point for the blood tests, and for the sleeve patients, you will stay at the Hyatt for 2 nights. For bypass patients, you will only be there for 1 night at the Hyatt, and your surgery will be the next day. So that's bypass patients will have their surgery day 3, sleeve patients will have their surgery day 4. And then there are either 2 or 3 nights in the hospital, depending on whether you are a sleeve patient or a bypass patient. And day 6 is when we check out, and that's on the Friday. And we will then travel back to LA, and we will stay another night at a hotel in LA. On the journey back, we do have a planned stop at Carlsbad shopping outlet. So if you feel up to it, you know, you can walk at your own pace and have a little shopping journey, a little shopping experience. Stretch your legs as well, which I'm sure you will need after a couple of hours. And then the next day, on the 27th of September, that's when we fly back to Auckland, arriving in Auckland again because of that time difference on Monday, the 29th of September, early hours. And so then you would need to arrange your return flight back home from Auckland. Did you want me to cover anything else there?
Sure. Yeah. Now, you know, so this basically itemizes what is covered and how much it is for September group.
Yeah, so I'm there as a dedicated guide, basically, as somebody who has been through it, to answer any questions, any expectations. So in the past, when I came over in April, one of the women that I came over with, she had just had non-stop questions, and needed that reassurance of what to expect next. So, you know, I'm that person that can answer the majority of your questions for you, if not all of them.
Yeah, I think, you know, at the beginning, it's kind of like it's scary to, first of all, you're getting a surgery. So that's a life-changing experience. And going to another country is, but when you actually go through this, it becomes, I think is a great experience, and it makes a mark in your life. Because not only you get the surgery, but you travel to Mexico, and the whole experience, I think, is unique. Especially when you come in a group with Vanessa. I mean, I work with her, I know how great she is. So anyhow, our approval process is very simple. You just fill out the health questionnaire by going to mexicobariatriccenter.com. About 48 hours, you get response to your health questionnaire to HQ. And once you're approved, you can actually book yourself online by paying a deposit and finding a slot that works for you and the surgeon. If you don't, of course, our coordinators are always here to help. And the next step is really just gather your information and put it on in our system, fill out the forms, and you know, make sure you have the passport and all that, and you're on your way to go down there. You know, one of the advantages of going with NBC is the support you get before and after. And now, of course, for you guys in New Zealand, now you have somebody local there. You know, we have several Facebook groups. I think we have one for New Zealand too, right, Vanessa? We have a, yes, we have a support group on Facebook for our New Zealanders, and basically you get to interact with these patients, past patients, who they share their before after pictures, they share their experience. You can this is great because you need to have that support before and after. We do bunch of webinars. We do, as I mentioned, the first Saturday, usually first Saturday of the month, we do our monthly webinar. Then you have surgeon Q&As, which we do on Wednesdays, 10 to 10:30 Pacific time. Could be a little early for you guys. And then our coordinators go live. Those are a little later. You can catch those. Our nutritionists go on online on webinars. And this is just a list of our past patients that they have the compassion to work for us. And they work day in, day out with us, with our staff. Of course, we have coordinators in-house here where I am in Sacramento. And, you know, we day to day, we're supporting patients. Sarita, Rena, Jamie, Kelly, Laura. Tiffany is our coordinator for plastics. Stacy just joined us recently. Anna is in Canada, and our great Vanessa in New Zealand. They do a podcast between Sarita and Rena. Make sure you listen to those. The exclusive network of the best bariatric surgeons in Mexico, Dr. Miguel Montalvo, Alejandro Gutierrez, which is our chief surgeon that is with us today, Rodriguez Lopez, Jacqueline Usuna, and Dr. Jesus Ceja. This is the best you can find. And our approval for the health questionnaires that you submit, this is how we handle those. Our surgeon liaison is sitting between your health questionnaire and the doctors. First of all, we have developed complex routines that when you submit a health questionnaire, we know what's the best, which surgeons are best for you. And of course, you know, it goes to the surgeon. If you don't select one, it goes to the one that matches you the best, your profile the best. And they review your HQ, they respond, but the surgeon liaison reviews every HQ that goes back and forth. She's one of the doctors, American doctors that went to school in Guadalajara, Mexico. And she's been with us, I don't know, almost 10 years. So this is the expertise that having their eyes on you, on your well-being. Our pre-op diet is very important. I want to emphasize, it's not very difficult, but do the best you can. The last 2 days of the pre-op diet is clear liquids, but depends on your BMI. You have to start earlier. Just low carb, high protein diet. Just make sure, you know, you eat healthy, you eat salad, maybe with fish or chicken. Keep your calories down below 1,000. Again, this is a really important phase for your surgery to go well, for recovery to go well. We talked about hospitals there. You know, during the COVID, we stopped taking companion and keep the companion in the hospital, but now we open that up. So if you come without the group and you have companion, they can stay with you or stay in the hospital or the hotel Hyatt. Please make sure you stop medication, any blood thinners 1 week before. If you're taking Ozempic, I don't know how many people in New Zealand have access to that, at least 3 weeks before. Smoking is huge, not to smoke before and after. Again, these are all factors that make your surgery less risky, less complication, and better outcome. Stop taking NSAIDs. But we would tell you, our coordinator and surgeon liaison will let you know the medication that you have to stop or start, when to start and when to stop. If you're taking a medication on a regular basis, please bring the bottle with you to Tijuana. So in case that you come by yourself, you be coming to San Diego, we pick you up, we want you to arrive before 12 noon, and your departure should be after 2 p.m. Again, you have option to stay days before, whether you want to stay in Hampton Inn. For example, Hampton Inn has a special rate for our patients, which is by the airport, or whether you stay in Hilton or Sheraton on the other side, on the harbor side. These are great places to just hang out. It's beautiful. Or you can stay with us in Tijuana. Again, just tell Vanessa about your goal, and you know, in the pre-op, we keep you in the hotel the night of the pre-op, and we provide Jello, broth, and popsicle when you're in there. On the day of the surgery, we get you prepared. You go to the hospital. Again, you could stay the pre-op night in the hospital if we have room. That's another option. But recently we've been busy, so we don't have that option to everybody. But you stay in hotel, and they will take you to the hospital. You stay there. We do all the leak tests. We do the surgery, and make sure you're good to go. You fly back home. Of course, in case of Vanessa, the group package would take you to LA, right? You stay one more night in LA, and then you fly out. The post-op diet is very simple, 4 phases, maybe in 4 weeks. Just go from clear liquid to solid gradually. These are huge steps that you're taking for long-term success. Now, I just need to mention real quick about the success of our procedures. We see, in the literature, you see 15% of patients require a secondary surgery, which we call revision, whether it's a complication from the first one or not getting to your ideal weight. But in our case, is only 5%. So when you're looking at different companies, price is not just one criteria to look at. You want to see the skill and the expertise of the surgeon, so they give you the result you want. And we had I just had another slide. I don't know if it's missing. So basically, our patients are losing, we talked about the extra percentage of extra weight, the more than the published data. Let's say if they say 65 to 75% of your extra weight you lose after gastric sleeve, our patients are losing average of 78%. Average. So the range, it should be really between 75 to 85%. Bypass, 84%. Do not switch, almost 89%. These are huge numbers. These are at least 10 to 15%. Sorry, our our timer goes off at 6:30. So 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 the numbers that we're getting from our patients post-op is 10 to 15% more than what average is supposed to be. So this is huge, you know. Now we get to why. One of the reasons is the surgeons we use. Dr. Alejandro Gutierrez is one of the most well-known surgeons, I would say worldwide. He's double board certified. He's not only a general surgeon, he's also a board certified bariatric surgeon. Again, he has done easily more than 6,000 bariatric surgery. You know, he is a part of FACS in US. He attends all the congresses, IFSO, national, international. They keep on top of the latest and greatest in their field. And you know, again, I don't have to say much about him because patients know him very well. But I let him take over and explain different procedures that we offer, and then I would be with you. Thank you so much, Dr. Gutierrez.
Thank you, Ron. Thanks. Thank you, Vanessa. Thanks all of you for being here with us, taking the time. We're very excited to looking forward for going to New Zealand. We will see you soon, so hopefully we can see you in person. So we're gonna go and talk a little bit about the procedures that we do. Most of the, well, we're guided by, as we were talking, ASMBS, IPSO. So all the techniques, the surgeries that are FDA certified, we are able to do them, and some others that are under revision, or they're just studying that. So, but with good results, so we can do that as with SACs. We were talking about SACs. If we can go through the procedures, we have the laparoscopic and the endoscopic, so we can divide it. We're gonna talk a little bit about in a few slides. So we have the gastric sleeve. Well, gastric sleeve is the most common bariatric procedure worldwide. So at first it started like a bridge therapy. It was 2 steps for people that were very heavy, and then they did just the sleep, wait a couple of months, and then they completed the surgery. But they saw that most of the patients, they were happy, they were losing a lot of weight, and they returned and say, I don't need to have another surgery. So that it was, gastric sleeve was born, and very good results. What we do is that we go directly into the stomach, and we're gonna take like 80 to 85% of your actual stomach. So gonna leave a tiny long portion of your stomach that looks like a sleeve, and the other portion of the stomach, we're gonna remove it, we're gonna take it out. So the function is, obviously, the first one, you get full very fast because you're gonna have a very small stomach. And second of all, we were talking about the hormones that does the metabolic process of your communication between your brain and your guts. So we're gonna take this portion out, and it produces a lot of hormones. Most known one is ghrelin, that goes into your brain and causes you hunger, that binge eating, those craving sensations. So after taking this out, your body's gonna produce much less ghrelin, so you're not gonna have that hunger sensation anymore. So this is the success of the surgery. Okay. We have the single incision gastric sleeve, the SILS. This is the same, it's a gastric sleeve, but the only difference is we do it only through one incision, through the belly button. So mostly for aesthetic purposes. Obviously, we have to meet some criteria. Yeah, your body, your BMI has to be on a lower level. Your liver has to be shrunk enough so we can do the surgery without have to lift the liver, and some other but it's mostly aesthetic. On the inside is the same, results are the same. So good. We were talking about endoscopic treatments. Endoscopic is like a new reach newer technologies that are increasing. And one of this is the endoscopic gastric sleeve or gastroplasty. What we do is that, well, this is not a surgery. This is just due through endoscope. So it's just an outpatient a procedure. What we do is that we go do an upper GI endoscopy. We check the stomach if everything's okay. And then through a special mechanism that we can be able to do stitches on the inside. We put stitches on your stomach to make it smaller. So endoscopic procedures are good. Obviously, the results are not the same as a complete surgery, but for people that are in the lower BMI that just need to lose a little bit of weight, or in the other hand, patients that have very big BMIs, or they have some problem, cardiac problems, respiratory problems that cannot undergo surgery at that time. We can do this. They lose a little bit of weight, and then they're able to do a surgery then after. Okay. We have the gastric bypass surgery. Well, gastric bypass surgery is still considered the gold standard of surgery. This one was done since 1950s. Obviously, it was open, had a lot of complications. It's different nowadays. Nowadays, almost we do the same as post-op as the gastric sleeve. So in this case, what we do is that we're gonna go through the stomach, the same. We're gonna cut the proximal portion. We call it the gastric pouch. And then, second of all, we're gonna go to the intestines since the beginning. We're gonna count, okay, approximately 6 to 8 feet in meters. We can say like around 2 meters, depending on your BMI, different factors. And then what we do is that we cut the intestine down there. We're gonna take the distal limb, bite it into that stomach, into that pouch, and the other limb we bite it into the same intestine. So it's like a Y. That's why it's called a Roux en Y. So the purpose of this is that food, instead of going through your complete stomach and intestine, is gonna bypass that portion, those 2 meters of intestine. So that portion is not gonna be in touch with food, not gonna be absorbing calories, but you have to keep in mind that the same is not gonna be absorbing vitamins and minerals, protein. So you have to take care on your diet and your nutrition and taking supplements, vitamins and minerals. Okay. Normally, when you fill your health questionnaire, some patients they want a gastric sleeve, or some others want a bypass, or some others want a duodenal switch. So normally when you pick a surgery, and then when you come down by, we have the time to talk and discuss before the surgery, when we know all your background and everything. So sometimes we tell maybe this one will be better for you, maybe this other. So to say and what is the best surgery for me. So normally gastric sleeve is for patients that are not on a bigger BMI, or in the other case that very big, so want to do one less invasive surgery and maybe lose a little bit of weight, and then we can do another surgery as a bridge. We have to take care that patients, if they have like GERD, very bad acid reflux, prior to the surgery, the best surgery to do will be the gastric bypass, because in this case we're gonna lower the pressure inside the stomach and release that the acid that could come all the way up to the esophagus. So that's one very important. Um, and well, both of them are an excellent tool. But obviously the gastric bypass is a bigger push. But in patients that they don't need to lose that much weight, gastric sleeve is perfect. Okay. We have the mini gastric bypass, or it should be called one anastomosis gastric bypass, or AGB. This is a type of gastric bypass, but with a little bit of difference in the technique. That's what we do. FDA approved it just like almost a little bit more than 10 years ago. And we have the data, the results, and we got amazed because the results are the same as with the Roux en Y gastric bypass. So results, we can tell the same. what we do is we're gonna go to the stomach, the same. We're gonna cut the proximal portion a little bit longer. We call it the pouch. And then we go to the intestine, those same 2 meters around. But the difference is we do not cut the intestine down there. We gonna take it as it is, and we gotta bite it to that pouch. So it looks like an omega loop. We call it in surgery an omega loop. So the it's called mini because instead of doing 2 cuts, 2 suturing, 2 staplings, is just one anastomosis. So it has the advantage of less bleeding, less percentage of a leak, and it's called mini because it's doing just one instead of two. Is like 15 minutes less of surgery. So that's the whole mini word. But sometimes patients they say, I don't want a mini surgery, I want the complete one. So it's not a mini surgery, it's just one anastomosis gastric bypass with very good results. Okay, comparing those two, the same. The mini gastric bypass, it's good. Both of them good results, the same. Most of the patients, they if they're taking insulin or medications for blood pressure, for glucose, for sugar, for diabetes, sleep apnea, all of them, they have like more than 80% of out a year getting rid of all those medications, that CPAP machine. So it the same. If we have a patient with very bad acid reflux prior to the surgery, the best thing will be to stay with the Roux-en-Y gastric bypass. But other than that, both of them are excellent in losing weight. We were at the beginning of this webinar, we were talking about the SACEs. SACE, it's under research, but we've seen that with very good results. This surgery combines a little bit the gastric sleeve with the gastric bypass, and kind of like SADIs. This one, what we do is that we do a gastric sleeve first, and then we combine kind of like a gastric bypass. What we do is that we're gonna go to the intestine, but from the last portion, from the colon, we're gonna count like 3 meters, okay? And what we do is that we're gonna take that loop, and we're gonna bite it to the stomach, to the antrum. So in these cases, if you could see, we have the normal complete root of the intestine, and we have a bypass portion that is just the last 3 meters. So it combines. And the studies now it's said that around 30% are going to go through the normal route, and 70% through the bypass portion. So it has very good results, very good metabolic effects. So as I said, it's under research, but so far we've been having very, very good results with it. Okay. We have the duodenal switch and the SADIs. These are, we can call it the most invasive surgeries, but with better results. This for patients that they have to lose weight because any condition, heart condition, any other one. So in the SADIs, what we do is it's gonna be kind of like SACEs, but in this case, we're gonna do a gastric sleeve first. We're gonna dissect through the duodenum, and then we're gonna in the duodenal switch, we're gonna count the intestines in the last portion, 3 meters, and then we cut it. The last portion we're gonna bite into the duodenum, the other portion we bite into the same intestine. So it's kind of like the Roux-en-Y, but for the duodenal switch. And in the SADIs, we do the sleeve, dissect the duodenum, we're gonna count the last portion, and we're gonna take it as it is in an omega loop fashion. So both of them are excellent, very good results. Obviously, it's a little bit more invasive surgery. At first, surgeons were scared because you have to do more dissect. We have to work on the duodenum, which is a critical part. But nowadays, with the technique and expertise, this is becoming a more easier surgery and with excellent results. So it's a good option as well. In these both cases, we have the advantage of we have the duodenum, the pylorus, so it's like a bulb. So it's gonna like a more anatomical effect, if you may. And the reflux could be a little bit less, but it's still if the same. If a patient has very bad acid reflux, the thing to do is a gastric bypass. In these both so if we can see are very excellent surgeries for patients that are very big on BMI because they're gonna lose more weight. You have to take care that this is you're gonna lose a lot of weight, but this is the most the surgeries that you have to do more maintenance on your vitamins, minerals, protein because you're gonna have the last portion of the intestine just absorbing them. And if patients do not take proper care on their diet, they could have diarrhea, constant diarrhea. So it's very important to keep that in mind. You will need to take your vitamins, minerals, be special taking care of your diet so you can have a good outcome. So. We have another type of surgery that we call it a revision surgery. This is when you already had a bariatric surgery, um, but then you regain the weight. You start having some massive acid problems, some other problems. So you need to convert into another one. So we can do almost all types of revision surgeries. Reversions, that's when it's very rare, like around 1 to in some studies around 1 to 5% that patients do a gastric bypass, but they go the other way and they go through a malnutrition state. So in those cases, we have to revert it, convert into a normal anatomy as well. So we can do that as well. So we have lab bands mostly all around the world. We're taking them out. It was a very good option back in the 90s, but now then we have better surgeries with better results. So mostly we're taking bands out, converting to a gastric bypass, gastric sleeve, or other surgeries. Gastric sleeve to a bypass, gastric sleeve to a SADIs to a null switch. So we have a large margin of surgeries that we can do. So this is a common question. A hiatal hernia. Um, Hiatal hernia could be common in obese patients, in overweight patients. Um, Overweight patients, their intra-abdominal cavity increases, so the pressure is increased. So that pressure obviously go to the weaker spots, and the hiatal where the esophagus passes through is a weak spot. Normally, we have it has to be like an inch, like almost 2 centimeters, 2.5 centimeters, width in the width, so the esophagus can pass through. But normally that happens because of the pressure that hole increases in size. So what happens is that normally the esophagus is like a rubber band, so it's gonna pull the stomach through into the thorax. So a portion of it increases. Sometimes it's very big, and most of the stomach is into the thorax. So what causes is that this is going to cause acid reflux and could cause another symptoms. But since whenever we do a restrictive procedure as the sleep, we always go and check if there's no hiatal hernia, because if we leave it unrepaired, patients could have acid reflux, bad acid reflux after. So we'll be better to repair it. So yes, normally when we see one, we repair it and you have a better outcome. Okay. Another common question is that a patient they have PCOS, polycystic ovary syndrome. So this what this is related to hormones in the fat tissue. So patients struggle to get pregnant, and after doing the surgery, patients get amazed because they get pregnant easier. Sometimes some once, twice. So this helps with that, and helps with other problems. But yeah, PCOS normally is gonna resolve or is gonna decrease to a normal point, and patients the fertility rate increases very greatly. Normally they always ask how soon can I return to work. So this is going to depend on different factors. For instance, one very important is the type of surgery that you had, the type of work that you do. It's not the same if you do a desk job and you're not lifting heavy things, and if you're like a truck driver or kind of like that, construction, that's different. So normally, we recommend around 2 to 3 weeks. Okay. I have to keep in mind that that you're gonna be on a pre-op diet, you're gonna be fasting during the surgery, you're gonna continue on a special diet. So patients mostly they feel weak the first couple of weeks, low on energy, but then after they gonna regain that energy, they're gonna have double energy. So normally desk job, some patients at a week can return to their job, and some other patients very hard work, they will need a little bit more than 3 weeks, up to 6 weeks, up to 2 months. So, but then after you can start doing your regular life, and you're gonna feel with more energy than before.
Thank you so much, Dr. Gutierrez, for explaining. I'm just going to touch base on all the other procedures we offer. Like I said, we have post-bariatric plastic surgeons. They are not just board certified for plastics. They have experience with patients who have gone through bariatric surgery, and that's huge because not everyone can handle that type of patients. It's almost like reconstruction surgery, but we do any type of facelift from mid-face to full face, eyelid, nose, tummy tuck, mummy makeover. Basically, it's a term that they use for multiple procedures in one operation. Usually we do breast lift and tummy tuck, or it could be tummy tuck and arm lift, or any of the combination. One thing about, as a company that offers these services, one of the things we do is like we're regulating this industry, and whether it's MBC or MCC cosmetics, we are paying attention to all detail about the qualification of the surgeon, the qualification of the hospital facilities. One of the things with the plastic is everyone wants to do all the procedures in once. It's really a dangerous proposition. You need to make sure you're not under more than 6 hours. And I see that often. They keep patients under for 8, 9 hours, and they want to keep them happy. So they give them more procedures that we offer. So make sure for your well-being, go to a place that they are not just trying to take your money and give you what you want. Again, breast lift, arm lift, thigh lift, and like I mentioned, we offer gynecology procedures like hysterectomy, endometriosis. We have a specialist for endometriosis that they're very hard to find in the whole, global market. So again, we take cashier's check, cash, of course, Zelle, credit card, and we have different types of payment options for you. Now, one of the other pluses to go with us, you get the medical tourism insurance coverage. We threw this in the group as included, so you don't have to pay. But if you come on a regular all-inclusive package, it's only $99. This covers complications, 45 days out, and it's almost a $300 package that we managed to renegotiate or negotiate with the provider to give us at $99 because of the relationship we have with them. So this is a great option. I recommend highly to everyone that goes with us. We do have this for plastics too. It's for plastics is $199. For bariatric is $99. Again, if you come in a group, you don't have to pay this. It will be included in your group package. Our nutritionist, we have in-house nutritionist, and you can always text, call, or email. She does regular webinars. Again, I can't emphasize enough about the specialized bariatric vitamins, whether you buy it from us or anywhere else. Make sure you buy a brand that is high quality and it has all the minerals and supplements that you need. Ours is made based on the ASMBS standards. Okay, so let me actually I need to, as I promised, I'm going to launch the New Zealand Zoom poll, and please go ahead. It's just 5 questions. Please go ahead and respond to those because that's a requirement for being entered into the raffle. Actually, these people who showed up here, they are very fortunate because I just heard that the marketing had a little flaw and some of the invitations didn't go out. So you guys have a great chance to grab the $2,000 off. And so let's see if we have any oops. So when you since you guys are doing the questionnaire, answering the questionnaire, I'm just gonna start going through the questions. Dr. Gutierrez is asking, what kind of lifelong complications may arise from a bypass surgery?
Okay, yeah, we were talking a little bit about that you have to keep in mind that you're gonna be absorbing less calories from your diet, but the same you have to keep taking your vitamins, minerals, have a good diet, a good nutrition. That's very important. Protein. So normally when patients do not take care of that, they can have more easily anemia. Their iron levels are down. They can have problems with their hair, with their nails, and mostly like vitamin deficiencies. Um, for long term complications, I would say that maybe for surgery they could increase the risk of internal hernia. That's very rare, but you have to keep in mind because we're gonna reroute the intestines. So, but that's the only thing. That's very rare, and if you take a proper care, it's normally that doesn't happen. Um, so mostly the same. If you eat like too fast, mostly carbs or protein, you can have a dumping syndrome. So normally when you feel that at the same time you take care right after, but we recommend for you to eat slowly, separate liquids from solid a half an hour, and some other a recommendation that we give you at time of surgery. So that's mainly.
Um, I'm going to let Vanessa answer this one. Elizabeth is asking, how safe is it to fly long distance so soon after surgery?
Okay, for us in New Zealand, we usually, well, I was advised when I was having my surgery to stay at least one extra night over in the States or in Tijuana. And so that's why we are staying that one extra night in LA. So if you are closer, then I believe they can travel the same day if it's just a few hour flight. But obviously our flight is going to be 10, 11 hours back home. So that's why we do the one extra night before we fly.
So the whole the group package has a lot of advantages, including the direct flight from Auckland to LA, to back to Auckland. There is something to be said about direct flight, but make sure you get up and walk around often on the way back. I don't know if Vanessa recommend, I mean, we always recommend them to wear compression socks on the way back. So, but again, it's a 10-hour flight is not too bad. And you don't have to be getting off, picking up your luggage, go to another terminal or run to another terminal. You know how the international flights are. And I mean, there is so much to be said about direct flights. And like one of them is if your first flight is late, you'd be stuck in the other airport. But anyway, so Karen is asking, we've talked about the high BMI, and what about the low BMI? So the low BMIs is usually, okay, so we have this team of surgeons that they cover anything from low BMI to high BMI, from endoscopic procedures to laparoscopic procedures to different procedures. So some of our surgeons take lower BMIs based on your specific, situation. And I've seen as low, of course, endoscopic, you can go below 30 to 27, 28. You can get ESG or, of course, gastric balloon, but probably ESG because you guys are long distance. But even the other procedures, for example, Dr. Usuna deal with the lower BMI. So if you have lower BMI at 30, I would suggest you ask the coordinators to submit this to Dr. Usuna and see if you are a good candidate for the surgery you want. But again, that's why we have different surgeons dealing with different procedures. They're asking about the minerals and vitamins required post-op surgery. So maybe Dr. Gutierrez can help me with that, and then I would inject my own thoughts. Okay, go ahead, Doctor.
Yeah, okay, thank you. Well, yeah, that's a good question. Normally, you will need to take your vitamins and minerals. Nowadays, there's a lot of brands. There are bariatric specific from the necessities after a bariatric surgery. We have to take special care at first of vitamin B1, B12, iron, copper, and then protein, obviously, as well. And mostly for example, when we do a gastric sleeve, we have in the stomach a special binding factor that binds into iron or vitamin B1, and that binding makes for the intestine to absorb it easier. So after you're gonna have a very, very small stomach, that factor is gonna decrease in production. So for the body's gonna be harder to absorb iron, vitamin B12. So just take your vitamins, minerals that are bariatric brand, and your nutrition, your diet, and that you're gonna be okay.
Okay, so just to when you go to emergebariatrics.com, let me see if I have to share this tab now. Or you see it. Okay, there you go.
You got Ron. Yeah.
Yeah, so emergebariatrics.com is where we have all of our vitamins. As you see, it comes in different forms. It comes in chewable, soft chew, capsule, and drinkable. And if you go to, let's say, chewable, for example, or soft chew, there is a label there that you can click and it tells you that. So basically, the difference between, let's say, a multivitamin and a bariatric multivitamin is that it has the amount of each ingredient based on the standards of ASMBS that your body needs post-bariatrics, right? So sometimes, for example, you have to take maybe 4 or 5 of the regular multivitamin for certain components or ingredients of this, but then you get so much extra of the other one. So this is more in certain ingredients and less in some, so with exactly what your body needs. And that's what we call a specific for bariatric patients. And so that's the difference. And when you take this, you are taking exactly what your body needs. Of course, there are some more patients who take DS, there are some other kinds, but multivitamin is the main one. And you can go to our website and see what's the component and maybe compare. Leonette needs to talk. I see a hand raised. I'm going to let you talk, but you are on mute. Please, if you need something to say, I don't know if you hand raised.
Oh, I didn't need to talk.
Okay, okay.
Thank you.
I saw your hand raised. Okay.
Oh, it was on my mouth. Yeah, sorry.
No worries. Okay, thank you. Anyway, so we are to the end of our webinar. Thank you everybody for taking time to participate. Dr. Gutierrez, I appreciate your time. Vanessa, the same. It's always good to see you. I'm at the point that I'm going to draw the name for the webinar winner. And let's see. Who's that person? So this is the winner, Winsome Sturgis. I guess I hope I don't misspell the name. So Vanessa, you know, would you like to talk? I can allow you to talk, to share your. Hello, hi, congratulations. Hello? Winsome, right? That's I saying his name. Okay. So yeah, you can talk. I can see you are unmuted, and but
Hello,
hello.
can you hear me?
Yes, hi. How are you? Congratulations.
Thank you so much. This is incredible. I am so excited. I've been following you guys for about a year, and it's taken me a long time to be ready, and I'm ready, and this is just such an incredible opportunity. I'm so grateful. Thank you so much.
Oh, you're welcome. So would you say that you would be traveling in our group, or are you coming
Yes,
by yourself?
I would love to come with the group travel in September if that is possible. Otherwise, I can come earlier. I actually have that flexibility. Yeah.
Okay, well, I'm glad to hear that. Again, everybody, appreciate you guys joining us. And we would try to do this more often, maybe every quarter. Again, be tuned for the groups that we are going to announce. I think Vanessa has one coming in January as well. We're working on details on that. And again, we would love to see you guys and the past patients in November when we come there. Please join us. I hope that the locations we go are convenient for you guys to join us, and love to see you there. Again, thank you, everybody, and thank you, Dr. Gutierrez. Thank you, Vanessa, and we'll be in touch again, okay? Goodbye.